Dear students, welcome back. This session we are going to discuss about the joints of the lower limb. In that, the first joint is the hip joint. The type of the joint is synovial joint and the variety is ball and socket type. If we see the articular ends proximally, so this is the proximal part, proximally acetabulum of the hip bone. So proximally, this is the acetabulum of the hip bone. Here you can find this acetabulum. And distally, the head of the femur. Distally, the head of the femur. Okay. Within the acetabulum, there is a horseshoe shaped. So this one is the horseshoe shaped surface covered with articular cartilage called as lunate surface. Below the lunate surface, there is a non-articular area filled with a pad of fat. So this one, okay, filled with pad of fat ensheathed in the synovial membrane. A fibrocartilaginous ribbon-like structure called labrum acetabulare is attached to the margins of the acetabulum. So here this red color you can find, this is called as acetabulum labrum, which is homologous to glenoid labrum in the shoulder joint. Okay. So the head of the femur is spherical, smooth and covered with articular cartilage. So this part is also covered with articular cartilage. So on the upper part of the head, it is having a pit-like structure called as fovea. Okay, so these are all the articular surfaces of the hip joint. So proximally, acetabulum of the hip joint, hip, and distally it is formed by the head of the femur. Okay, now we will move on to the ligaments, hip joint capsule and ligaments. So there are different kinds of ligaments. Or there one is the first one, the hip joint capsule, and next one is the transverse ligament. Okay, next a round ligament, and the very important ligaments or and the strong ligaments are iliofemoral ligament, pubofemoral ligament, ischiofemoral ligaments. Now we are going to discuss one by one. The first ligament is called as capsular ligament. Yes, here this is the hip joint and the hip joint is covered by and hip capsule. Okay, how the capsule here is? The capsule is loose, thick fibrous sac. This is loose and thick fibrous sac enclosing the joint cavity. Its inner surface and non-articular parts inside the capsule are lined by the synovial membrane. Okay, here if you can see, here the neck is non-articular part and the articular part is only head. So this neck of the femur is also present inside the capsule. Okay. So how this capsule is attached? Proximally it is attached to the margins of the acetabulum. Proximally it is attached to the margins of the acetabulum and also proximal to the acetabulum labrum. Okay. So proximal to the acetabulum labrum, the hip joint capsule is attached proximally. Okay. And distally it is attached to the trochanteric line. So here this one is the trochanteric line. So distally it is attached to the trochanteric line anteriorly. Okay. Upper part of the neck of femur close to the greater trochanter above. So here greater trochanter above, and lower part of the neck of the femur close to the base of the lesser trochanter. So here is the lesser trochanter. Okay. Yes. And these are the attachments. Okay. And to the posterior surface of the neck or femur 1 centimeter proximal to the trochanteric crest. 1 centimeter. So this one is the posterior aspect. This picture is posterior aspect. So on the posterior aspect, um, the neck of the femur 1 centimeter proximal to the trochanteric crest. So this is the trochanteric crest. So 1 centimeter above this capsule is attached. Okay. After gaining attachment to the femur, the fibers of the capsule are reflected and run proximally along the neck of the femur. They form the retinaculum of the neck of the femur. Okay. And the capsule is made up of superficial longitudinal fibers. This capsule is made up of with superficial longitudinal fibers. Okay. That and deep circular fibers. And deep circular fibers called as zona orbicularis. So if you can see here, around the neck we can find a band like structure, okay, some collar like. So this part is having the deep circular fibers called as zona orbicularis, which encircle the neck of the femur. So these are all the attachments of the capsule. Okay, now we will see another ligament called transverse ligament. Okay, the transverse ligament bridges across the acetabular notch, which is a gap in the lower part of the acetabular rim. So this one is the acetabulum. So this lunate surface, and it is having a gap here. And this one is attached by a ligament called as transverse ligament. Okay, and this ligament is continuous with the acetabulum labrum. Okay, this is about the transverse ligament. Okay, now coming to the round ligament. So here the round ligament is cut in this picture. We can see here. Yes. So this is the round ligament. It is triangular in shape. Here you can find this is triangular in shape. Its apex is attached to the pit. Apex is attached to the pit on the femoral head. The base is attached to the margins of acetabular notch. Margins of the acetabular notch. It helps to hold the articular ends together. And also in early childhood and fetal period, it serves to transmit blood vessels to the head of the femur. Okay. And we'll move on to the next ligament. This round ligament is also called as ligamentum teres. And next we'll move on to the other ligaments. One of the strongest ligaments around the hip joint. There are iliofemoral ligament. On the anterior aspect we can find iliofemoral ligament and pubofemoral ligament. Okay, this iliofemoral ligament is also called as ligamentum bigelow. Okay, yes, it is the strongest ligament in the body and it is inverted Y-shaped. So this one is inverted Y-shape. Okay, this ligament is inverted Y-shape. Above it is attached to the lower part of the anterior inferior iliac spine. Anterior inferior iliac spine. Below it splits into two bands which are attached to the upper and lower parts of the intertrochanteric line of the femur. Okay, in between these bands the capsule is weak. In between these bands the capsule is weak. So this is about the iliofemoral ligament. Next, coming to the pubofemoral ligament. Pubofemoral ligament. Proximally this ligament is attached to the iliopubic eminence. Iliopubic eminence. Okay. And also the superior ramus of pubis and obturator crest. And distally it passes under the medial band of the iliofemoral ligament and merges with the capsule. Okay, this is about the pubofemoral ligament. Coming to the ischiofemoral ligament, which is seen on the posterior aspect. The name itself indicates ischiofemoral. It is attached to ischium and the femur. Okay, proximally it is attached to the ischium below and behind the acetabulum. Below and behind the acetabulum. Distally the fibers run spirally. So here you can find the fibers will run spirally, okay, on the capsule and merge with it. Some fibers are trabeculae, or sometimes these fibers are traceable to the upper part of femoral neck near the greater trochanter. Okay, if you see the ischiofemoral ligament, proximally it is attached to the ischium, below and behind the acetabulum. Distally, the fibers run spirally on the capsule and merge with it. Okay, so this is about the ligaments of the hip joint. Now we will see the blood supply. The blood supply of the hip joint, it is mainly supplied by the obturator artery and two circumflex femoral arteries, which are the branches of the profunda femoris artery, and next one is the two gluteal arteries. So gluteal arteries. So here you can find the gluteal arteries. Okay. Yes. Now the medial and lateral circumflex femoral arteries. So here you can find, so the profunda femoris artery giving two branches. One is the medial femoral and lateral circumflex, and these form an arterial circle around the neck of the femur. Okay, the reticular arteries arises from these circle and supply the intracapsular part of the neck Okay, and also the greater part of the head of the femur, A small part of the head near the fovea capitis is supplied by the acetabular branches of the obturator nerve. These are called as acetabular branches of the obturator nerve. Smaller part of the head is supplied by the obturator artery, and greater part of the head is supplied by the retinacular arteries, which arises from the circle which are formed by the medial and lateral femoral circumflex arteries, and these two are the branches of profunda femoris arteries. Okay, so these are all about the blood supply. Okay, and now we will move on to the nerve supply. So the nerve supply of the hip joint. The hip joint receives the nerve supply from the following nerves here. One is the femoral nerve. So on the anterior aspect, this sends a direct tweak to the capsule of the joint. Okay. In addition to supply a tweak through the branch supplying the rectus femoris, and also the anterior division of obturator nerve, and also the branch can be given to the hip if the accessory obturator nerve is present, and also the nerve to quadratus femoris, and superior gluteal nerve, which supplies a tweak to the joint. Okay, so these are all the about the nerve supply. Okay, and we'll move on to the movements which are taking place in the hip joint. One is the flexion, extension, abduction, adduction, external and internal rotation. So these are the movements of the hip which are taking place around the hip joint. So what are the muscles responsible for all these kinds of movements? Okay, so we'll start with extension. So this one is extension. Extension of the hip joint is by the hamstrings and the gluteus maximus muscle. Okay, and coming to the flexion. Flexion is by the, if you see the flexion, the chief muscles of the flexion are psoas major and iliacus, and also the accessory muscles which are pectineus, okay, pectineus, gracilis and rectus, femoris, and mainly adductor longus, which mainly participate in early stages. Okay, so now we will move on to the adduction. Adduction is mainly by the adductor group, that is adductor longus, adductor brevis and magnus, and the accessory muscles are pectineus and gracilis, helps in adduction. Okay, and if you see the abduction, so just think that the muscles which lies on the lateral aspect of the hip, those muscles helps in abduction. One is gluteus medius, gluteus minimus and minimus. These are the main muscles, and accessory muscles are sartorius and tensor fascia lata. Okay, now if you see the medial rotation is mainly done by the tensor fascia lata and anterior fibers of gluteus medius and minimus. Lateral rotation is done by the obturator externus, internus, and also the gemelli. Okay, so gemelli and the quadratus femoris. These are the chief muscles, and if you see the accessory muscles for the lateral rotation, you'll get the piriformis muscle and also gluteus maximus and sartorius helps in lateral rotation. Okay, this is all about the hip joint. Thank you.